Sometimes patients get confused regarding the electrical terms we manage: arrhythmias, supraventricular tachycardia, fibrillation, fluttering. The importance of that is to understand that when they come to our practice, all of those terms do have a very specific connotation regarding the mechanism that is involved in their problem.
Arrhythmia is a big global term for anything that's wrong with the heart. So if it beats out of sync, if there's extra beats, if it's going too fast, if it's going too slow, if it's going erratic, that's the big global term for arrhythmia. There are a number of different arrhythmias. Generally, we divide them into fast rhythms and slow rhythms. That's tachycardia and bradycardia. Bradycardia could be the natural pacemaker of the heart going slow, called sick sinus syndrome. It could be the connection between the upper and lower chambers, which leads to heart block, which is either first degree, second degree, or complete heart block, and those are treated with pacemakers. Fast arrhythmias or tachycardias are either supraventricular, above the ventricles, or ventricular. Ventricular can happen in the face of a normal structural heart, and it's not life-threatening and it can be fixed with an ablation, or it can happen in patients who do have a weak heart, either from a virus that injured the heart muscle or heart attacks and coronary disease. Those ventricular tachycardias can be fatal and are usually treated with a defibrillator and then medications or an ablation. Arrhythmias from above the ventricle, called supraventricular tachycardia or SVT, includes several different things. One is you could be born with an extra circuit right down the middle of your heart next to the AV node, which is called dual AV nodes, and they can circle around. Or you can have an accessory pathway on the outside of the heart, either the left side or the right side, and it circles around in short circuits. Or you can have a little focus in the upper chamber called atrial tachycardia, and that can be in the left or the right upper chamber. Cardioversion for atrial fibrillation is done to reboot the heart. That's if you're in atrial fibrillation, you don't stop fibrillating, and we need to shock it to jumpstart it back to normal rhythm. That gets it there, but it doesn't keep it in normal rhythm. Then you need either medications to keep you in normal rhythm or an ablation. And the choice of medication versus ablation has its pros and cons. For instance, medication is just taking a pill rather than having a procedure. The problem with medications is that they work only 50% of the time on average. If they do work, you have to take them long term. They all have potential side effects, and they all have an associated cost. The advantage of an ablation is that after one procedure, you can have a cure of the arrhythmia at an 80 to 85% success rate. The disadvantage of an ablation is it is an invasive procedure and there are risks involved, but the risks are less than 1% of any complication.